sometimes you talk about a single, double, triple. This is a home run all the way around. And I think you're right. I think it's going to change the landscape and the requirements for proof going forward in the PAD. I hope it does.
I would echo Bill's sentiment that this is a complete game changer. I think we're entering into an era where we're going to demand comparative effectiveness data. I think this is a milestone for PAD therapy, where we now have such a powerful trial, such a powerful message of superiority of Eluvia over PTX. It's been so desperately needed in our clinical practice to have level 1 evidence to allow us to make clinical decisions for our patients, and so it's a welcome relief that we can now stand by level 1 evidence.
So what's really interesting is the fact that you get to look at the Zilver PTX database on a longer data set. So only averaged about a little over 4 centimeters in their own trial, and now we're talking over 8. Lots of CTOs, lots of calcification, so much more challenging, baseline population compared to the typical one. And I got to hand it to Boston Scientific for having the fortitude of faith in their scientists, faith in their engineers, to actually come out and go head to head with another device that's already out there that has shown benefit. So this is, like Rob said, this is the kind of data we need to be able to make clinical and economic decisions.
I raised the comment about the patient population because when all of us think back to the early days of vascular device trials, even against performance goals, over 60% of these patients, Bill, had moderate to severe calcification. Most of those patients would not have been included. They would have been selected out in the early trials, right? A third of the patients had CTOs. These were beyond 8 centimeter long lesions. So these are not chip shot, straightforward cases, and as you said, it extends the perspective on drug-eluting stent technologies in the periphery.